Hi everyone, it's Dr. Dalton with Seven Bridges Chiropractic. As you can tell, my voice isn't quite matching up to our video. We had a glitch with the system and for some reason didn't get any volume on this one. So I am here with one of my patients, Miss Yanika. She has some right SI joint dysfunction and right-sided low back pain that kind of comes and goes. She comes into me whenever that kind of flares up. So she does pretty well between visits. I think what we determined in the video, it had been about 4 to 6 weeks from her last visit. So what I'm going to do is just kind of talk you through what is going through my head. I talk a decent amount and keep conversations with patients, but you guys don't get my little internal dialogue. So Miss Yanika actually has worked in chiropractic offices and has been adjusted for a while, but was having a lot of issues with this reoccurring right SI joint. And when we did an evaluation with her from the get-go, she had a lot of weakness that pertained to her major hip flexor muscle, her psoas. So what we do is a full body adjustment with her. As you can see right now, I'm going through and loosening up her upper back because she holds some tension there. But we'll spend a decent amount of time in her low back as well, working through the psoas and the piriformis and her glutes. She sees a lengthy period of time between adjustments when we do that. Prior to, she was getting adjusted pretty frequently. So here what I'm using is just a little bit of Palmer's cocoa butter. It's so that I'm not kind of ripping through their skin or giving them what we call like an Indian burn. And what I'm doing on every pass when I'm running my fingers up the neck like that is I'm not only feeling the muscles and like there she has a knot on that side, but I'm feeling how the joints are moving under my hand when I'm moving her head side to side. So there you can see I'm really high up in her neck, feeling into those suboccipital muscles. And then we're going to rotate and adjust that side. And same thing on the other side. So she had it a little higher up on that left side, needed an adjustment, and a little bit lower on that right. Go back and make sure everything's moving well. And as you can see, she's got that bugger of a knot on that left side. So it'll be the right side of your screen. What I'm going to do here is I'm looking at her SCM or sternocleidomastoid muscle. You can't really see my thumb very well, but I am pinning down one of the scalenes as well, working through that to help, because she did this visit come in with a little bit of soreness in the neck on that left side. Now what I'm going to do is adjust through that low back. I really do like this A to P or kind of a hug adjustment. It's easy on the patient. It's easy on the doctor. It gets great relief through that mid back. And I'll have her roll on her side. This is her bad side, her right side. So we start off with that psoas muscle. The first couple passes, I'm just seeing kind of where she's at from the last visit, as well as feeling if there's any major knots or kind of tender spots for her. And as you can see, her leg does come back pretty far. She does have some good hip mobility there. Dropping that knee down just to make sure we're getting all of that muscle there. Good. So there I'm on the upper part of that, the psoas portion, and then that muscle actually kind of has fibers that go into the iliacus muscle as well. So we'll work through that, and then here I'm working on that back side of her hip into her piriformis and her glute med. Now we're going to go ahead and adjust that side, so getting her in that right position, really aligning that right side up. And actually it didn't move great on that adjustment, to be honest with you. I didn't love it, but sometimes with adjustments their other side is lacking in motion, so much so that adjusting the opposite side and then going back to that side really will help allow that joint to mobilize easier. So that's what we're doing here. We're working through that left side. Same thing. We're going to check her psoas as well as her piriformis muscle. And then I'm going to come around and adjust this left side for her. She's probably asking me some question that I absolutely cannot recall, but that was of importance between that. So there, we really got some good motion on that left SI joint. We're going to go through. I'm going to pull both of her hips. That will help open up. Oh, actually, I'm doing her knee first there. And then, so that left knee was bothering her a little bit. And then we'll do that left hip and ankle pull. She gets really kind of compressed with everything that she does. So opening all of that up, that'll help open up that right sticky SI joint that we'll come back to at the very end of the video. And then the massage gun. Actually, no, we're going to go with Flexion Distraction. She does really well with this because, like I said, she gets some compression from sitting as well as training. She is a personal trainer. And so sometimes when she loads her spine, it gets a little more compressed. But that, as you could see where she was pointing, that right side's still a little sticky on her. So we talked about, I was trying to loosen up her low back muscles a little bit more to allow for a better adjustment when she goes back on her right side. So Flexion Distraction is a great method. What it does is it mimics how your discs get hydration, which is called imbibition. It is similar to kind of like an opening and closing motion. So the flexion and the coming back up from the flexion mimics that. And then the rotation component really allows for the more specificity on that side. So we'll go through and kind of loosen up her whole back there. And then I'll go grab that massage gun and run it through her back. I really like that as just an overall global relaxation for the mid back and low back. It's definitely not a necessity, but it is a feel good type of modality. So we'll utilize that, just kind of running it upper spine, going all the way to the top, and then we'll go over top of the shoulders, really making sure we're getting into where those trigger points like to hang out in that trap muscle. And then here we'll feel, how's that right side moving? You can see it's just not quite moving as well as that left side was. I'm not liking it, so keep coming back to that area. And then we adjust through that back, and now you can see I'm asking her to go back on her right side because I really didn't like how that right side of her SI joint moved during that adjustment. So get her back in a better position, really check, make sure that what I was feeling before, I still am feeling. And then we'll drop a couple times. There we go. That last one really did it in for her. So then I'll have her go back on her stomach so I can check that SI joint again. And now you can see I'm really kind of palpating, moving that around, making sure that she's got that movement so that she doesn't have a snafu between this adjustment and the next time that she needs us. So here she's just kind of saying how much better she feels and how you need to come visit me. So if you would and don't mind, go ahead and like, comment anything below, and subscribe to this video.